What is chiropractic care? Is it safe to receive such care during pregnancy? What conditions within pregnancy can chiropractic care benefit? Are there risks? I'm Dr. Stacy Merlot, Doctor of Chiropractic, and today we're discussing chiropractic care in pregnancy. This is Preggy Pals.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way.
Welcome to Preggy Pals, broadcasting from the Birth Education Center in San Diego. Preggy Pals is your online, on-the-go support group for expecting parents and those hoping to become pregnant. I'm your host, Stephanie Glover. Thanks to all of our loyal listeners who have joined the Preggy Pals Club. Our members get special episodes, bonus content after each new show, plus special giveaways and discounts. See our website for more information. Another way for you to stay connected is by downloading our free Preggy Pals app, available in the Android, iTunes, and Windows marketplaces. You can download our new network app so that you can access all of your favorite new mommy media shows on the go. Here's Sunny with more information about how you can get involved with Preggy Pals.
Hey everybody, I'm Sunny and I'm producing today's show, and we love to hear from the people that are listening to our shows. We love hearing from our listeners, and there are a couple great ways you guys can get involved. We have various segments, and you can go to our website to learn more, but there's a couple that I wanted to point out to you. One is our Ask the Experts segment, and it's a great way if you guys are pregnant and you have pregnancy-related questions for you to go ahead and email your questions in, because odds are if you have that question, then somebody else out there has that question too and needs to hear the answer as well. So you can either email us or you can call our voicemail, which is 619-866-4775, and give us your question, and we'll have one of our experts answer that question, and we'll include it in a future episode. We also have another segment that I love, and it's called Pregnancy Oops, and it's where you guys share your funny pregnancy stories, and Lord knows we have so many funny stories that happen to us when we're pregnant because of that lovely pregnancy brain, right? And so we want to hear those stories. Same thing, you can email us or call our voicemail, and we'll include it on a future episode.
Awesome. So let's take a moment to introduce our panelists. I'll start first. So again, I'm Stephanie Glover. I am the host of Preggy Pals. I'm also a trained childbirth educator, and I do some work with some local pregnancy nonprofits here. I am fortunate to be home with my kids as I do all this. I've got 2 little girls, ages 2 and 4. Gretchen, the 4-year-old, was born via C-section, and Lydia via VBAC. And Stacy, since you're a mom, I'll have you introduce yourself in this way as well.
Okay. I'm Stacy Merlot, and I have 2 children as well. I have Kaya, who is 6, and Jaden, who is 4, and they were both born at home.
Awesome.
I love that. I'm Sunny. I've got 4 little ones at home. I have a 5-year-old boy. I have a 3-year-old boy, and then I have identical twin girls who are 22 months as of yesterday. So kind of had one of those little fake birthdays where it's not really a birthday because they're not 2, right? It's just 22 months. And they're growing up super fast. So.
And our phone panelist, Natalie, go ahead and introduce yourself.
Okay, I am Natalie Taylor. Fortunately, I'm at the hospital right now. I have 7 little ones at home. I have fraternal twin boy girls who are about to be 4. They turned 4 this month, actually. I have identical twin girls who just turned 2, and I have identical twin boys who just turned 1, and then I have my newest little addition who won't be our baby anymore, who is 9 months old, and then I'm currently expecting quadruplets.
So is the
3
math,
boys and 1 girl.
Natalie, is the math then 11 children total once your quads are born? Did I do the math right?
The math is 11 total, yes.
Oh my God. See, yeah. It's hard to count that high this early in the morning.
You're my hero.
And
Wow.
As a programming note, Natalie was actually on Preggy Pal's sister show, Twin Talks. We did an episode on moms of multiples. And not that we have time to go into it now, but Natalie's whole family has multiples. It is a crazy situation. But Natalie, we're so glad that you were able to join us for today's show.
Thank you very much.
All right, so before we kick off today's show about chiropractic care during pregnancy, sometimes we like to talk about pregnancy headlines, especially when they're kind of crazy, and it's interesting to talk about them. And this headline I just looked at and I kind of rolled my eyes, but I thought it was worth talking about today. The headline is How Pregnancy Makes You Sick Decades Later. And what they're saying is scientists say that cells passed from baby to mother during pregnancy can linger in the woman's body for decades. And some of those cells may be good for her health, but others, depending on where they hide in her body, could raise her risk of a host of illnesses. And they include breast cancer, thyroid cancer, arthritis, early menopause. They say all of those could be triggered or exacerbated by these quote unquote alien cells. And they also say that the cells may be effectively trying to sabotage the mother's chances of having another baby, so the fetus will not have to compete for resources after it's born.
Black widow cells.
It is. And I understand like the whole survival of the fittest kind of thing, but I kind of feel like this is a little sci-fi, someone was kind of bored one day and tried to, think of ways to scare pregnant moms. I don't know.
Well, and I think where you get so many conflicting ideas when it comes to science, and you've heard the research that suggests breastfeeding moms are actually at a lower risk for certain, breast cancer.
Right.
So it's just interesting when we see these type of studies.
I know.
I think they should study Natalie.
Natalie, can we give them your contact information?
Go ahead.
Well, these scientists, they actually say that this phenomenon occurs across the quote-unquote animal kingdom. It's very Lion King of them. And I guess it's a team from Arizona State University that are claiming this. But then, regarding breast cancer, they also say if certain cells, they don't really, go into detail about that, but they could protect, if they settle in the breast, it could protect against breast cancer and make it easier for a woman to breastfeed. So
interesting.
Yeah, who knows? But
I feel like there's going to need to be some more information.
Yes, I think so.
Yeah. Today, we're learning all about chiropractic care during pregnancy. Joining us here today in the studio is Dr. Stacy Merlot, Doctor of Chiropractic. Dr. Stacy is co-owner of Good Vibrations Family Chiropractic here in San Diego with husband and fellow chiropractor, Dr. Joe Merlot. For the past 11 years, she has worked in private practice, focusing on adjusting prenatal and postpartum moms as well as children. Welcome to Preggy Pals, Dr. Stacy. It's great having you.
Thanks, Stephanie. Thanks for having me. I'm super happy to be here on Preggy Pals.
So let's get started by just going over what exactly chiropractic care is.
Yeah, I so often in my practice, I hear people, they come in and they're like, oh man, I really wish I would have known this sooner. And it really breaks my heart. And so I'm super happy just to be here and to be able to educate people and get the word out there about what chiropractic can do and how it can help you really enjoy your pregnancy and get the most out of your pregnancy and really thrive.
Right.
Chiropractors, we're experts in the nervous system, which includes the brain, the spinal cord, and all the nerves that go to travel to the body. We specialize in detecting any interference in that nervous system, and we remove it using our hands to make gentle and precise adjustments.
Awesome. And so I don't know that all women even know that it's an option for pregnancy care. So That's great. Is there any special training or certification that a chiropractor would need to have in order to work on a pregnant woman?
Well, Stephanie, all chiropractors are able to adjust pregnant women. However, there are specialized training programs that we go, like I took a specialized training program through the International Chiropractic Pediatric Association, and they have various diplomate and certification programs, including the Webster Technique certification. But like any professional, you seek out, really trust your intuition, find somebody that you connect with that you feel really good about seeing.
Okay, great. And can you elaborate a little bit more on the Webster Technique? What is that?
Sure. Yeah, the Webster Technique is a specialized way to analyze a person's pelvis and to balance out the joints, the ligaments, and the muscles in the pelvic structure. It helps to relieve tension in the pelvis, and it creates an optimal alignment for the birth canal, the uterus, and the baby. And the technique is absolutely amazing in the results that it can get for the pregnant women that we take care of.
Okay, awesome. And now, Natalie, you have experience in chiropractic care during pregnancy, correct?
I do.
With how many of your pregnancies were you able to see a chiropractor?
I've been pregnant about 6 times, And out of those 6, I was lucky enough to experience chiropractic care in 3 of those 6. And the other 3, just my pregnancy status or like my situations didn't really allow me to have chiropractic care. But in the 3 pregnancies that I was lucky enough to experience, I can't find the words to say how much it helped me with the pain that I was suffering from.
That's awesome. Were you feeling a lot of pelvic pain or in your back?
Well, with experiencing twins back to back, every time that you find or discover that it's a new set of twins, you throw your body into shock. In the sense of, oh, great, I have to stretch out this much again, or, oh, great, this is the weight that I can experience or that I'm going to experience, stuff like that. And so I turned to what I thought was going to help me was massage, like prenatal massage care, and I just found out that was not cutting it.
Well, and you make an excellent point because the body does really go through so many changes. I can only imagine what multiples can do. But Dr. Stacy, what changes in the pregnant body affect the spine and nerves?
Yeah, the weight distribution changes in the abdomen or the tummy area. It increases the lumbar curve in the low back area, and that will also create stress to the pelvic area. Increased breast size and density can weigh the shoulders down and pull it forward, and that can create a lot of tension in the upper back and the neck area. And then all the organs that used to sit down tightly packed into your abdomen, now that baby is occupying that space, especially in the case of multiples, all those organs will get shoved up way up into the rib cage, and so the rib cage has to open up and expand in order to accommodate that. So we get shortness of breath and tightness in the rib area and into the shoulder area because of that. I tell my pregnant moms that when I was pregnant, I never sent my husband out for that like pickles and ice cream run, but there were a couple times where I had to wake him up in the middle of the night to adjust me because I know I wouldn't have slept the rest of the night because a rib would go out or my hip would be sore because you have to lay on your side all the time. So all of those aches and pains, and he was my savior in those times. And, I tell my pregnant moms in my practice all the time that, as soon as you can get in here to help get alleviation from these symptoms, the more comfortable and the more enjoyable your pregnancy can be. There's no need to suffer as much as a lot of women do through their pregnancies.
Right. And also another tip would be to marry a chiropractor.
This is a good thing. I was extremely grateful for my husband on those times, for sure.
I actually did receive some chiropractic care at the end of my second pregnancy because I was hoping for a VBAC and I was going to try anything and everything. My daughters both kind of fall into the OP position, which we can talk about in a little bit. But one challenge for me was just making it to my appointments because I already had a toddler who was a handful. But now I remember when I was getting adjusted, there was a little device, and I never remember the name of it. It almost had like a vibration, or it reminded me of like a hole punch or something.
Yeah.
What is that called? How is that used?
There are 2 different devices that some chiropractors will use. Okay. One is called an activator, and the other one's called an integrator. So they're very similar.
I think it was the activator, if I recall.
People will say, stapler or something like that. They get that kind of clicky sensation.
Yeah.
And that's just a super gentle way because pregnant women, they get that secretion of relaxin into their body. So that helps with the elasticity of their ligaments and helps stretch and open things up so the pelvic girdle can open up for baby to pass through. So pregnant women need really gentle adjustments and low force adjustments often because they already have really loose ligaments. It just takes a little bit of input to get it to balance out. And so sometimes chiropractors will use their hands, but lots of times they'll use those instruments. And some people feel more comfortable with one or the other. Some people feel one works better than them. And so in our office, we have what we call a whole tool bag of tools and techniques that we can use. And we talk to the pregnant moms and work through with them. Did this work? What did you like? We talk about their past experience. So if they've been to a chiropractor before, what did they like? What didn't work? What worked great? And we tailor it towards them.
Okay. And I do have to say it was your husband that I saw when I was pregnant.
Awesome.
Yes. Now, Natalie, did you have any experience with an activator or an integrator?
I didn't. Like you just said, more people prefer the hands-on experience. And I had gone to a person locally here in Texas that was very, quote unquote, good with her hands. And she knew all the pressure points and trigger points and that my body needed at that instant. It was really nice to feel one-on-one pressure instead of going to an activator.
I think there is a lot to be said too about the human touch, especially when you're pregnant, making that connection. And so that's great. Thank you for sharing that experience. Now, we're learning here that there are benefits to chiropractic care. Do there tend to present any risks for mom or for baby?
Yeah, there are no known contraindications to chiropractic care during pregnancy. Of course, if you're carrying quads and you're on bed rest, that's a different story.
Right.
But when we see a pregnant,
I have a different case.
Yes, you are unique. But when we see a pregnant mom for the first time, we do a thorough health history to rule out any more serious issues that may require referral to a specialist. But it's rare that we find a pregnant woman we can't help in some way. And for the large majority of pregnant women, chiropractic care is extremely safe for both mom and the baby.
Okay, great. And you mentioned, when your husband would adjust you in the middle of the night. So comfort in sleeping is a benefit, obviously, like helping those loose ligaments sort of settle and expand and sort of helping that process along. Are there other health benefits in general or in pregnancy really to chiropractic care?
Yeah, absolutely. So like I mentioned before, the primary focus of chiropractic care is to remove stress and interference in the nervous system, to allow the brain and the body to communicate with each other so it can function optimally. So all areas of your body can function better when we get that brain and body connected and talking to each other. I say some of the positive side effects of being adjusted would be pain relief, increased energy, better sleep, mental clarity, hormone balance, improved immune function, and just general overall better health.
Well, yeah, that seems like it would be great for pregnancy.
Absolutely.
So when we come back, we will discuss how chiropractic care can affect baby in a little bit more detail and learn more about that. We will be right back. Welcome back. Today we're discussing chiropractic care during pregnancy. We've learned about how chiropractic care can help with pregnancy health and comfort. Let's find out more about how it can affect baby and your labor and delivery. Dr. Stacy Merlot is our expert today. Okay, so we've discussed some risks and benefits to chiropractic care. Now, Dr. Stacy, I read somewhere that receiving chiropractic care while pregnant may reduce labor and delivery time. Is that true, and how so?
Yeah, Stephanie. When the pelvis is misaligned, it may reduce the amount of room available for the developing baby. Like Natalie was saying with her multiples, they just don't have enough room. And sometimes even with single babies in there, if there is restriction or an uterine constraint in the woman's uterus, it can decrease the baby's ability to position. I kind of use the analogy of like your uterus is like a hot air balloon and it's suspended inside your pelvis and it's tethered in there with the ropes are kind of like the ligaments. So if there's any knots or tension and twisting in those ligaments, it may twist the uterus or it may tip it one way or the other. And then baby's not going to present straight shot down the birth canal for optimal position. So optimal positioning, as you know, is so important for progression of labor, decreasing the pain in labor, and decreasing the need for intervention. So if we can help the pelvis to open up and make sure that the nerve supply to the pelvis is optimal, balance out those ligaments so that hot air balloon is puffed up nice and full, then that can really help improve the baby's presentation, which will decrease labor time and increase just the mom's comfort during labor.
Okay, and so we're talking about positioning and presentation. That could mean if a baby is breech, correct, or OP, which is
occiput.
Occiput. I always fumble on that. Posterior or sunny side up, as people refer. I also saw something pretty interesting about shoulder dystocia and how perhaps chiropractic care can help with that. Can you touch on that at all?
Yeah, again, just getting that uterus and getting the pelvis opened up, getting the uterus balanced out. Baby's going to be, because in chiropractic, we talk a lot about innate intelligence. So your body has this amazing ability. It made this baby from 2 cells, and it knows when it's ready. It knows when it needs to come, and it knows what positioning is going to be optimal. So if we get the body connected, we get the brain communicating with that baby, we get the environment ideal for that baby. Baby's going to twist and turn and get its shoulders, get tucked in that nice tight little ball that it needs to, ready to come through.
Awesome. And Natalie, in your experience with labor, now did you go into labor with any of your kiddos?
With my first 2, I did. I went into active labor, and Sunny knows my story. I went into labor in an IHOP. Oh. My water broke in an IHOP.
You are full of great stories, I've got to say.
She belongs in a movie, I swear.
Yeah, that was one of the most embarrassing moments of my life. Besides the first time that I was pregnant and I sneezed and I peed myself. And I was wearing white pants, so enough said.
Do you feel like the chiropractic care that you received helped you in that labor experience? How was your baby, or how were your babies positioned? And
each kind of one of my pregnancies were different in the sense of the positions of my babies. In my first one, I did go into active labor by myself. In the second one, I did not. I had to be induced because one of the twins were transverse. And then in my third and fourth pregnancy, in the third one, the twins were so large that they actually had to give me chiropractic care to go up inside me and move one of the twins into active labor position. And then in the fourth one, I was a singleton, and she was so large. She was 10 pounds, 9 ounces, and 23 inches long. So she was posterior, and so they had to adjust her as well, which we all know, if you've ever been pregnant before, being adjusted in that kind of way is not really that comfortable until after the adjustment is over. And then you're like, oh, that feels great.
That's actually a wonderful point, and I didn't have that on my list of questions. But Dr. Stacey, what is the comfort level of an actual treatment or adjustment? Do some women feel pain during an adjustment, or what would you say the sensation is like?
Yeah, I would say pain is rare.
Okay.
It should feel really good. It should feel really comfortable. Sometimes it's that sort of yummy kind of pain when like you're getting a good massage and someone gets into that knot and you're like, oh yeah, we're
the purposeful pain.
Yeah, and it's like, oh, and you can feel that it's working and that it's releasing something. Because sometimes like the psoas muscle, which is right in deep in the pelvis, it gets really locked up and tight. And so sometimes we have to go in and really release and open that up. Sometimes those joints have been really locked up. The longer it's been locked up, the more inflammation is in that area. So the more tender that area is. Ribs, we move those ribs 24 hours a day, 7 days a week. And so to get them back into place, they're really irritated and tight around there. But what we want to do is make sure that we're as gentle as we absolutely can, and the adjustment should be as comfortable as it absolutely can.
And how often do pregnant women, how often is it recommended to receive the chiropractic treatment when pregnant?
Yeah, frequency depends on many factors.
Okay.
When you came into our office, we would have done a specialized computer analysis of your nervous system, which includes a surface EMG reading and a thermography reading, which is just detecting any interference and stress in your nervous system. And then we do a thorough health history and physical examination, and those things will really help us determine how frequently we would need to see a pregnant mama. Some pregnant mamas who are having really great, healthy, uncomplicated pregnancies, we may see them once a month to bi-weekly. And then someone who maybe is trying to have a VBAC, who has a posterior baby, who may come to us at 37 weeks and it's
was totally me, I feel like.
Then we need a much higher frequency at that time because we don't have a lot of time and we really want to work to get that baby to change position quickly.
Yeah, I think I saw your husband maybe 3 or 4 times, and then my schedule didn't allow for it. But what I would like to think is that it did have some positive effects, because I had my OP baby led to a C-section the first time, but my OP baby in my VBAC labor turned during labor. So, I would like to think too that I was doing everything I could to really optimize my pelvis and make room and sort of take the stressors out of my body. So it was a pretty neat experience. Now, we have listeners all around the U.S. I mean, obviously we have our panelists from Texas, so not everyone can see you and your husband, but what should our listeners do to find a Webster certified chiropractor in their area? What are the best resources for that?
Yeah, if you're looking for a specific Webster certified person, you would want to go to, there's a website. It's www.icpa4kids.com. Or no, .org. Sorry. So that will help. They'll have a whole list of Webster certified or ICPA diplomat or certification certified chiropractors by a geographical area. And then it's great to get connected to your mommy community, because referrals are one of the best ways, because there's lots of really amazing chiropractors that may not have done that specific certification technique, but are really competent in taking care of pregnant moms. So definitely getting connected in your community and word of mouth and looking through your moms.
Also, Preggy Pals actually did a whole episode on the Webster technique. So you guys, if you go to newmommymedia.com and type in Webster technique, you can listen to that episode as well.
Well, perfect. Well, Dr. Stacy, thank you so much for joining us today. For more information about Dr. Merlot, as well as information about any of our panelists, visit the episode page on our website. This conversation continues for members of our Preggy Pals Club. After the show, Dr. Stacy Merlot is going to be discussing how chiropractic care can benefit infants. To join our club, visit our website at newmommymedia.com.
We have a question for one of our experts. Patricia in Tampa, Florida writes, my childbirth instructor mentioned something about the brewer diet, but that seems like a lot of protein. Do I really have to eat that much to have a healthy baby?
Hello, I'm Lindsay Stenevec, a registered dietitian nutritionist in San Diego, California, USA. Patricia, I'm so glad you asked this question. As you know, the brewer diet has many detailed nutrition recommendations, including an intake of 80 to 120 grams or more of protein per day and at least 2,600 calories per day for any woman that's following the diet. Personally and professionally, I'm never an advocate of diets, especially when they suggest there's a one-size-fits-all approach. I've noticed advocates of this diet can sometimes create a sense of fear and urgency around nutrition that can make the eating experience more complicated for pregnant women. I've also had clients who are stuffing themselves well past their comfortable fullness levels due to the urgency they have to meet this diet's recommendations throughout their pregnancies. While for some women this type of intake might feel fine, following this type of diet is not necessary for you to achieve a healthy pregnancy. In order to ensure you are getting enough protein each day, you can simply calculate this by multiplying your weight in kilograms by 1.1, and this can be done during your second and third trimesters. There's really no need to increase protein in a particular way in your first trimester. In addition, be sure to get a balance of fruits, veggies, whole grains, lean meats, and dairy products or calcium-containing foods. And don't be afraid to indulge in cravings for foods that don't fit as well into these categories like ice cream or cookies. The more we try to ignore cravings, the more we tend to focus on them. Most importantly, listen to your body's hunger and fullness cues for guidance on how much you need, as this will change from day to day and from trimester to trimester. During pregnancy, women have to balance things like shifts in hunger, heartburn, nausea, and early fullness, so cookie-cutter nutrition recommendations won't always fit perfectly into your day-to-day life. Some days you'll need more, and some days you'll need less. As long as you're getting a variety of foods and listening to your body, you're probably doing just fine. If you are having a difficult time getting the correct nutrition during pregnancy, consult with your doctor or midwife, and preferably a registered dietitian who works with pregnant women. Thanks.
That wraps up our show for today. We appreciate you listening to Preggy Pals. Don't forget to check out our sister shows, Newbies for postpartum moms during baby's first year, Parent Savers for parents with infants and toddlers, Twin Talks for parents of multiples, and the Boob Group for moms who breastfeed. This is Preggy Pals, your pregnancy, your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
New Mommy Media is expanding our lineup of shows for new and expecting parents. If you have an idea for a new series, or if you're a business or organization interested in joining our network of shows through a co-branded podcast, visit newmommymedia.com. Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording, so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.